So now this is the big results. So I don't know if there'll be a drum roll or applause, but we'll try it out. Oh my gosh, there really is a drum roll. Wow. So after that drum roll, over 3 million fewer harms and adverse infections over the past 5 years. Approximately 125,000 lives saved and over $28 billion in cost savings. So seriously, give yourselves and all the people you represent a round of applause for that.
I like to think about the difference between an implementation gap and a knowledge gap. There are important knowledge gaps, but there are also implementation gaps where we know what to do, but we're not doing it. And stroke is a good example of that. Of all of the strokes that occur today, most of them, about 45%, almost half that is, could be prevented just by better implementation of the simple, clear tools we have available.
The point was made very well that we still have lots of opportunity for improvement. I was particularly struck by the opportunities to improve cardiovascular risk factors, to reduce the leading cause of death and disability in the United States, and health disparities.
We also know that collaboration is necessary. And we talked about the patient safety goal that we've achieved and the huge success. 87,000 lives have been saved because of the work and the commitment you've shown over the last 4 years.
There's so much synergy between what we are asked to do with providers in terms of correct antibiotic prescribing that also applies to correct opioid prescribing. And the synergies are going to help us really get the outcomes that we need to get.
What I'm so excited about as I think about this current program cycle is the coordination of care communities. I think when we look back in 5 years or 10 years, that will be the lasting legacy of this program cycle.